I want to educate you on you. I want to empower you in times of adversity, and I want to equip you to heal yourself because you can. Welcome to season 1 of my podcast, Unshrinkable. Hi, I'm Emily Katz. My guest and I are here to help you find what works for you beyond traditional therapy and mainstream meds. Hello, everyone. I am so excited to introduce our amazing guest today, Aura. Hi, Aura.
Hi.
She's the founder and director of Live the Pain and has over a decade of experience building innovative mental health and trauma programs across Israel, US, and Canada. Aura has made significant contributions to sexual abuse prevention, mental health rehabilitation, and pediatric social work research. Living with chronic pain herself, Aura has recognized the critical need to apply trauma-informed approaches to chronic pain and medical care. So, Aura brings a wealth of knowledge and personal insight to our conversation today. We are so lucky to have her here and to share her expertise with us. Dr. Michelle Flamm-Hall, a professor and author, highlights Aura's impactful work by saying that Live the Pain's groundbreaking trauma-informed group-based approach to patient care is unique, timely, and necessary if we are to help people heal in mind, body, and spirit, which is what we're all about here. So get ready for an enlightening and empowering discussion that sheds light on the intersection of chronic pain and trauma. Breathe. Let's dive in. Aura, please introduce yourself and specifically tell us how you got here doing what you do.
Hi, thank you, Emily. Thank you so much for having me. It's so nice to speak to you. I learn from every conversation with you. How I got here, I'm don't know where to start, but I'm a social worker working in the mental health trauma field for many years, with sexual trauma, with different kinds of mental health issues. And I myself live with chronic pain. I grew up in the medical system, just not connected to that, just born with scoliosis, health conditions, things like that. And I went through a lot of medical stuff as a kid. But when I was in my early 20s, I was in a car accident and I developed chronic pain. And I'm highlighting both of those things because it's amazing. Through that, I realized, and went through really dark time. And through that, I realized how different chronic pain is from other medical care, how the medical experiences, because it's invisible, because it's not understood, it doesn't get treated. It doesn't get treated right. There's so much psychological, social things around it that makes the experience much worse than the thing itself. And holding those two comparisons of like, wait, I know what it's like to go through medical care and not be traumatized, and then the experience of chronic pain, how traumatizing it is. So that's a little bit about my background. And then I started off by saying I'm a social worker. Through my work in the trauma field and other fields of trauma work, I started realizing in Hebrew, you say nafalia simonim, started having these understanding and insight. There's something really helpless about chronic pain. In the medical world's approach to it, in the mental health world's approach to it, there's so much misinformation. In comparison to the trauma field, where there's so much hope, there's so much effort to discover new things. Also, so many treatment approaches that really make a difference and brings in a really different perspective. And starting to realize, one second, these theories and understandings are so relevant to the world of chronic pain. Why is nobody looking at it? At chronic pain, the trauma of chronic pain. Why is no one even looking at medical trauma? When children and adults are going through these really intense experiences that if they happened anywhere else except for a hospital, they would be considered abuse. But here it's for the good of the patient, and no one's looking at those elements. So that's sort of where I started to
the connections were made, and
connection started to fall, and then I started researching what exists around the world, who's looking at it from this way, and realizing that nobody's really doing it in such a way. Start putting together, developing models with experts in the field.
Amazing pioneer, trailblazer. I love it. I'm so excited. Okay. So what I did, we started talking about this before, but we're going to cover this now. A lot of the other episodes that I have in this podcast focus on beyond traditional psychotherapy and psychiatry, meaning how do we heal ourselves? How do we, reduce our symptoms or reverse our symptoms and our diagnoses without using traditional psychotherapy and meds, right? And so I wanted to ask you a little bit about your work, because does it still include psychotherapy and psychiatry, or is it like, what can you tell us a bit about your work right now?
Sure, thank you. And I love the work you do, and I love that approach. I'm always like, whenever as I speak, I'm speaking from two, like I have two different perspectives that I'm holding. One is myself as an individual who lives with pain and trauma and is always seeking and in movement and trying to find solutions for myself. And I'm speaking as the director, founder and director of Live the Pain, where I have responsibility to other people and I'm bringing something to them. So that's really important. I just want to mention that I'm holding both of those. I'll just give you a brief about what we do in Live the Pain. We have two, recognizing that chronic pain falls through the cracks of the medical system because it's invisible. It's so hard to get a diagnosis. Years like endometriosis average 7 to 10 years. So much being told it's in your head, go to therapy, whatever. Real fragmentation of the patient. And then they come to therapists, social workers like myself, psychologists. And we, first of all, we're not trained on chronic pain at all. When we are trained on anything related to health or pain stuff, a lot of times it's from this psychosomatic approach of like, pain develops as a result of something you've been through. And if you just, if it possibly, pain, trauma lives in the body keeps the score. We all know that. However, it's not necessarily always the case. But holding this message and this approach that if you just do enough therapy on your trauma, on your underlying trauma, on your emotional stuff, it will get rid of the pain. Now that does not happen. And I worked enough in the trauma field to see that, people who have been through incredible trauma work, 10 years of therapy with the top therapist in Israel, the top therapist in the US, and they really, really healed their trauma and they really got back to themselves, but they still had their fibromyalgia or endometriosis or Crohn's or colitis or arthritis or scoliosis, all of these things. So what is the message that we're sending them? And it really, and just a background of where Live the Pain came from. So to address these issues, and it creates just a lot of shame for patients. Really, if you just did enough work on yourself, if you manage your life better, if you healed enough emotional stuff, then you would be pain-free. And it's not. And by the way, this is much more important when we're talking about people who do have a trauma background, who, the mechanism of sexual trauma, the mechanism of abuse is it's your fault. You wanted this, you asked for this. And now they're developing pain as 15, 20, 30, 40-year-olds. And we're telling them the same message, essentially, like if you tried hard enough, it wouldn't have happened. So it's really, really a really hard place to like hold. That's where Live the Pain was brought from. And this is what we're trying to create solutions for. So we operate on we have two departments. One is professional training for mental health professionals and medical professionals, really to give them the knowledge and tools to work with this population. Because it's not enough. It's not enough. Like they don't have an understanding. They don't have the knowledge. They don't know how to work with people. And they're frustrated and they, like himself Gimmed said, absorb it and they suffer from it, the professionals, but they don't know how to work with it. And then, so we do professional training with HMOs in the community. And then we have a treatment department where we developed a group therapy model, and we're in the middle of developing, by the way, the individual therapy model, a group therapy model protocol for people living with chronic pain. It's a trauma-informed approach. It's a 16-session group. It is run by professional therapists, and I'll tell you why. And it's a goal of the group is to help people reclaim their lives. Every session is a topic related to chronic pain, the physical. It's really the goal is to help them heal the physical, emotional, interpersonal, and traumatizing aspects of chronic pain. And through that, reclaiming their lives and getting back to who they are. A big part of the experience of chronic pain is not the physical. Like I'm not even addressing the physical for a moment. It's the loneliness. It's the fight, flight, freeze mode that your body gets into. It's the experience of your body attacking itself. It's a relational trauma. We know from other fields of trauma of abuse that more traumatizing than for a child who's going through abuse, more traumatizing than the abuse itself is when they reach out for help and they're not believed. Yeah. The research shows that that's more traumatizing, and that's the experience of chronic pain. So we're dealing with people who are not only traumatized from their body in medical procedures, even if the professionals are all amazing, which often isn't, but a lot of times there is, this stuff is really violating. People are violating people's bodies. People are violating their privacy. And then they're dealing with these relationships that, you come and you tell your spouse, your partner, your children, your parents, and they tell you you're being crazy, you're just lazy, you don't want to help, you're just looking for attention, you're being hysterical, dramatic. And this is the experience over and over. And that's what we're looking to heal. We're helping people heal. The group is based on, like I said, a trauma-informed approach. It's also based on its biopsychosocial. We look at all, because like I said before, that we're divided between not only the physical and the emotional, the orthopedist and the rheumatologist and the physio and the massage, nobody's talking to each other. And your emotions and your soul is being dealt with somewhere else in the best case scenario. and we want it all in the same place. The power of the group, and another thing is that it's built off of this combination of evidence-based research and knowledge from lived experience. Which means, and that's related to your question, it's not bullshit. This is not a program that's built. I'm not, a lot of programs in chronic pain are, I healed myself from this, you can heal yourself too. No. If it was so easy to heal ourselves from all of these diseases, then we would have all done it, right? Like there is no one solution. There's no magic solution. There's no one treatment that fits everybody. The nature of chronic pain and health and illness is that things are constantly dynamic. So if, people say, try yoga, try that, for me, it doesn't work. And by the way, when I tell people it doesn't work, you know what their first response is? You just haven't found the right teacher, right? You haven't found the right, and maybe, maybe it's true, maybe it's not, but there are so many options out there. Our goal is to help people, pain and trauma really disconnect the person from themselves. It's like a chaos, a tornado, a tsunami, whatever. And the gaslighting, it really disconnects people. People don't know how they feel. A lot of times, physically or emotionally, they don't know what to believe, if what's real or what's not, because everyone's telling them that what they feel is real isn't real anymore. And we want to help them ground them back in themselves, because that's the biggest tool of healing. It's not me. It's not anybody else. It's not a treatment approach. It's the person being connected enough to who they are and to be able to feel this is working, this is not working, this is what I want to pursue. And what works for one person doesn't work for the other. What works for me 5 years ago doesn't work for me anymore. And we see this constantly. Someone says my migraine medication worked for me for 5 years, it stopped working. That's the nature of it. And we want to keep people, first of all, seeking and in movement and being connected enough to say, this isn't right, or it's not working, or it's doing damage, which relates to your question of, medication, traditional stuff.
Yeah.
If it works for, I believe in everything. And I believe in, more importantly, people making their own decisions and balanced
What works for them.
and balanced decisions, right? Like if I take opioids and I'm aware of what the impact could be, and it's the only thing that helps me, but I'm going into it with my eyes wide open, and that's what I need, and that's what's going to help, it's my right, The problem is a lot of times we get prescribed things, and all of us, I've been prescribed, I don't take them, but I've been prescribed opiates many times without being told they're opioids, without being told what the risk is, without being asked if I have an history of addiction. Mm-hmm. And it's not just opioids, even though they have a bad rap. It can be medical marijuana, it could be psychiatric medications, any treatment approach. It's not what I'm not against or for anything. We want people to be able to say, 1 second, people go, I have scoliosis. Many people go into surgeries thinking, and really serious spinal surgeries, thinking it will heal their pain. And very, very often it doesn't, and it makes it worse. It's like this insane process. And what we want is for people to make an educated decision. They're the only ones who are going to have to live with it. And honestly, placebos work. I use natural stuff. I use tinctures that work for me better than opioids. I don't know why, but they do. And I know somebody I laugh about in presentations, but then I really met someone who did it. Someone told me to try, there's like a thing for bee stinging. You get bees to sting you for your inflammatory pain, right? One of my sisters once told me about it, and she says, I saw it in a magazine, you have to try it. I was like, you're wacko, whatever, I'm not doing it. And then a few weeks ago, I was randomly talking to someone, she lives with lupus or Lyme disease, I don't remember what. Mm-hmm. She says, you don't understand where I came back from today. It's the only thing that helps me. There's a lady who stings you by bees, and it is the only thing that helps. And I'm like, what? Good for you. Who cares? Who cares?
100%. I mean, look, this is why I've decided to do this podcast the way that I've done it, which is literally like give a platform for everyone who's found what works for them, because there is no one size fits all, and there is no one way. We are all different. We're all unique. We're all having our own lived experience. And speaking from lived experience, like I'm coming as well as a consultant saying, let's find what works for you, right? Because everyone is different. And most people will be like, this worked for me, and so this is the only way. No, it's not.
No, it's not. And that, let me tell you what works. It just creates a shame spiral, because what a lot of times experience of pain and trauma is like,
if it doesn't work for me, what does that mean about me?
Then what? Right, something must be wrong with me, because everyone says yoga changed their lives. And I have nothing against yoga. I happen to be, Pilates works for me better, but yoga changed their lives. But for me, it's not working. Something must be wrong with me. Or there's always this feeling, and maybe you can relate, is like you're one step away from finding that magic solution. Like there's like a merdaf blissof, like it's just one more approach, one more therapy, one more modality, and then it's all going to go away. And that's not the reality. And who amongst us hasn't tried everything? And I will try, but I mean, I'm not trying bees. I could live with back pain. I'm not getting stung. I'm saying, but who hasn't tried everything? How many therapies have we all been to, physical and emotional? Who's not trying? there's not that one more piece. There's like these pieces of the puzzle that we're just trying to live better. And that's the name of the organization. My organization is called Live the Pain. It's like, let's get this mirdaf, this like chasing our tails to find magic is often what's keeping us. It's not just us, people push it on us, but like it's keeping us stuck into something. And when we accept this is a reality and it could change, it could get better, it could get worse. We don't know. We have no, then we could actually face the reality and live with what we have and actually heal from what we're experiencing.
Okay, so just to clarify then, it's you're finding ways to manage the pain and while healing trauma, like you're living with the pain, accepting the fact that there will be pain.
Yes, I wouldn't say manage it because I think manage has a lot of sense of control. And I think if we were able to manage things so easily, then it would be a very different reality. And I think a lot of times that can make people feel really guilty. It's living with, it's like reclaiming our lives. I know it's like a catchphrase. What our principles, our beliefs is that through processing the trauma and the pain, the physical, the emotional pain and trauma and experience of it in relationships and how that impacts everything, people will be able to reconnect to themselves and live life, right? And I say live not just as like a function, I say as live, like this is a reality. Okay, can I give you an example?
Yeah, sure.
Okay. We had somebody in our group who she joined our group on Zoom. She couldn't join physically. Young woman, early 20s, probably, developed some sort of pain condition, had to leave school, move back in with her parents, like leave everything. Her life fell apart. She had to join our Zoom group instead of in person because she couldn't get out of bed. Okay. And then we have therapists. You asked about therapists, so I'll tell you. The reason they're run by therapists, I'll tell you that after. I'm going to finish the story. But it's really important. We have therapists that run the groups, and a lot of times I do focus groups and interviews with all participants after, so we can learn. When I say knowledge from lived experience, this group isn't just made on my experience. It's learning from every single participant and all the time, constantly working to sharpen the model and make sure it's suitable.
Beautiful.
So I meet with them, and I met with her, and it was amazing. I asked her, what needs improvement? What did you get from the group? And she said, I came into the group, it was really beautiful. She says, and not that what is beautiful, I mean, it is, but also the why. She says, through the group, I found the love of my life. Okay. And I was like, wait, what? Like, we're not a matchmaking. And it's not somebody in the group. I said, what do you mean? She said, when I joined the group, she said, I didn't believe that anyone would ever love me. That I would ever have, and she's like really young, 20. She says that I would ever find love, that anyone would be able to tolerate with me. I had no life. And that was my biggest fear. And I said, so how did you find love? Like what changed? And she said, I realized through the group that you have to take chances and take risks in order to get something. And for me, that was, with my health, I started going back to treatments and whatever. This is what happens when you get rid of this, like there's one magic solution. You have to take risks and be vulnerable. I said, in a relationship, be vulnerable and put yourself out there. Like it brought me to tears because, one of the things with the successes of our group, and we have, we have measurement and evaluation, we have quantitative and qualitative, and we really see everyone's success is their own. Like we don't tell people go live in a relationship or go find somebody. But she realized, she's like, I'm being stuck behind waiting for the pain to go, living, stuck in my own, Dalit Amot, however you say that. And I realized I have to step out. And even if it hurts, and even if I'm going to suffer losses, and even if I'm going to get hurt again, the only way to live is to take risks. And she did. And she found somebody. And aside from that, which was so beautiful, and aside from that, because that really symbolizes for me what the group is. It's like, yeah, it's going to hurt anyways, but what are you going to get? Let's add that energy. So much of pain management and pain world is like doing so many things to stop the pain. Like, okay, so like I'm only going to walk, or I'm only going to swim, or I'm only going to go out with friends when I'm not in pain. And when you realize, like, no, 1 second, pain management or healing, physical healing is one part of my life. But first of all, you need to, like, it's really, really energy draining. You need to add energy. You need to bring in energy from other places. And like, yeah, if I go dance at that party or that wedding, it will hurt. And I might be stuck in bed for a week, but I'll also have gotten something. And what's that thing that I'm getting? And that's what we always look at. It's from the trauma world of pendulation, of like
a reframe.
It is. And it's expanding, it's opening channels, and it's expanding the way we look at ourselves. right? Because yeah, it's okay to choose pain.
However, reframe is crazy.
And it's being able to choose something and say, I'm gonna choose pain. It's okay to choose pain. What are you gonna get? And let's open our neural pathways to be able to realize, wait, so right now like I'm sure you're feeling things right now. Maybe you're tired, maybe you're fighting with somebody, maybe you're, I don't know, whatever is going on in your mind, but you're choosing this conversation with me because you're getting something out of it. I'm choosing this conversation with you because I'm getting something out of it, like the energy of connection. And that is something that we work on, is like, let's open, we have pain and we also have life. And by the way, this woman, she said at the end, she says, I want to join another group. This time I'm going to be able to do it in person because I'm able to move out. She went back to school. She started working. It's like this, you step out of that freeze mode of panic and freeze and life is over. And by the way, it's not just a sentence. It's something that they do this intense process with therapists. And the therapists, by the way, are really important to the group because we're talking about really traumatized people who need to be held and who need to, but also the group is critical, because when you're told you're crazy and you feel crazy the whole time, there's nothing like the experience of sitting with a bunch of people who understand without you having to say a word. Mm-hmm. And that's not someone from outside. That's not a therapist and that's not a doctor. Someone who knows, then that releases so much of the tension and so much of the pain and so much of the fight with others. And then you're like, okay, I'm not crazy. I'm normal, and people get it. And then that's the place from which you move. And by the way, that's also the place. And we had at the end of one of our groups, we did a focus group, and they said, we don't even know what pain people, like what conditions people have anymore. I forgot. Cause like, it's so not relevant. Like, we want to look at people. We want, that's reclaiming your life. Like, who are you? Like, okay, we know you're the endo and the fibro and the this and the that and the trauma and the person who is, but like, who are you? And let's help you reconnect to that so that that's the energy. Anyways.
I love that. I can completely understand how it is so healing on such a multi-dimensional kind of like, wait, it's there's so many things that I want to say, which one to choose.
I would love to hear what you have to say. I'm talking.
I was gonna say that one thing comes to mind is when I was in a treatment program for my post-trauma. And so it wasn't chronic pain, physical pain. It was physically, I was having very strange kind of symptoms happening and going on, but it wasn't pain. But nevertheless, it was a group program. And I remembered that for me, one of the things that stuck with me was when I arrived, they were like, what's wrong with you? Why are you here? And then I would share my story and they'd be like, okay, now we get it. But we would sit outside and we would chat outside, like in between the therapy sessions. There's like movement therapy, art therapy, group therapy, all these things. And I remember they would say, participants, like patients with me, they would say that I was helping them more than the therapy. Mm-hmm. And I think it was because of the lived experience. Like, I understood, like I could see them, like I actually got it. Yeah. And I like that for me is my work is in response to, I think, my lived experience with the therapists that I came into contact with, which don't have the lived experience, right? Like, and for me, that is a piece of, I think it's really important to kind of know it, which is why you're the founder and director, right?
It's really powerful. And just from my conversation with you, I think that, my previous conversation is you also not only see people, you also are you're very open, honest, and transparent. Mm-hmm. And that's really powerful because there's so much shame around health stuff and mental health stuff and trauma, right? People don't talk about it. And when we send people into individual therapy rooms and it's pathologizing everything, right? And somebody, most of the things that we deal with are normal responses to abnormal situations.
100%.
And when you
the amount of times I say there's nothing wrong with you, there's that your body is doing everything it is exactly designed to do to survive the situation.
Yes.
Stress response. It's like, why am I fawning when I'm being sexually harassed? And it's like, because fawn is an actual stress response, like you're trying to keep yourself safe. And it's like, now I get it, but I didn't get that at the time, shaming myself for that situation.
Of course, and nobody talks about it. But one second, do you know how smart it is that you're fawning right now? Do you know how smart that is? That's the only way you can get out of it. How many of us have been in cabs, or I'm just like taking it, to any situation where we're just like, and I think the moment we start saying, why am I doing this? That's the moment maybe where there's a little part of us that's saying, this doesn't serve me anymore. Like, I don't need this response anymore. And let's do some work around that. but that's really, really powerful, more than so many individual things. That's why our first group model was supposed to go live, and then Corona exploded. After working so hard on developing it, and so many people told me, "Or just do it individually, like do individual, like don't put it on hold." And I was like, "No, no, the individuals for after, but the group there's something you're gonna get. It's not my protocol, is lovely. It's amazing. It's been, really shown." But it's not about the protocol and it's not about the therapist. It's about the people, seeing other people. And that's really, really also one of the most powerful things, is that not only do you see yourself reflected and mirrored in other people's experiences, you also give, and so many people go from feeling like a burden and needy and dependent, and also like, no, people, I've seen many people say this, like, all of a sudden I realize how good I have it, or how much I'm able, and it's part of that empowerment process, of giving that back. I do think, and this is place where all my groups are run by psychologists or social workers who have extensive experience in training trauma, because it's a very, when you're talking, it needs to be safe. And there is something, and it can be sometimes that when you get people with chronic pain together or certain types of traumas, there can, and this is very well known in the online forums, it can be a comparison. It can be like this hierarchy of pain, because there's such a, and I'm not going to minimize it, because there's so little legitimacy and validation of pain, and you're constantly having to show people and tell them, right? Because I look fine, you look fine. Nobody sees what we're really dealing with on the inside, physically or emotionally. There's constantly like trying to prove it. And then what happens what can easily happen, number one, is when you get people together, there's this comparison hierarchy. Who has more, who has it worse? And there's also like this mishmata, like this dragging people down, because it's such a heavy topic. And I think there's place for that. But another thing is, our group, we want to help people, like, pain lasts longer than 16 sessions, right? You're not going to come out of our group with, by the way, our group does show that there's a significant decrease in pain, but that's not the goal. And we want to give people tools and knowledge and tools, and we want to keep them, I say this in Hebrew, that's my goal, is not just to pretend the pain doesn't work, yalla, go forward. How do we make space for the pain, and how do we make space for life? And if it's just a support group, and if, a lot of times it goes in the other direction, and that's why we want therapists to bring the protocol and to work with people. What do you do when people are traumatized or triggered in the group from each other? And this happens all the time. We're talking about a group of traumatized individuals. The fight, the flight, freeze, or fawn response, group dynamics come up, suicidality comes up. We have people in our groups, many people in our groups have been sexually abused or have gone through other things. It doesn't even, and my top priority is, like, really my top priority is not protocol. It's not, it's not me, it's not protocol, it's not the organization, it's the people who are in it. And they deserve to be held and cared for and seen in a really, really healthy way, in a way that's going to help move them forward. And that needs to be held by therapists who have been through our training, who are supported by our supervisors, who are guided by, what I mean? So it's really, really tightly held. And
I also think that by the way, I think I was specific, like me specifically, I was kind of unlucky, maybe with the therapists that I actually had over the years. I do believe that there are therapists that are very well trained and well informed, and I think now as well, when I was in therapy, it was years and years, a few years ago now. So I think that things are changing and things are
like, you've never been to traditional therapy that's been effective.
Yeah. I mean, I think that there are good bits to it. At one point it was a lifeline for me, but I always felt disempowered and dependent. And for me, those are two pieces that I wanted to change. And it was a gap for me that I wanted to fill. I wanted to help fill. For me, I want to empower people, and I want to help them feel independent. That, like, as in that they're in charge of themselves. They know themselves better than anyone else, and to empower them to go out and get educated, get empowered, get equipped to find what works for them. Because no shrink ever told me that I could reduce my symptoms, that I could reverse my diagnoses. Like, I'm, I guess, very lucky, but that I was able to find the things that worked for me, that have reversed my diagnoses for me. But I think that it's a disservice in a way. It's like, I think on this piece, we're maybe two ends of the spectrum. For me, it was a disservice that no one told me that I could heal. right? In a way. And then
Yeah,
I think there were some things that you said, it's like, it's a disservice to tell everyone that they can heal, they can heal, they can heal, they can heal, right? Because it puts that pressure that there's something wrong with them if they're not healing. But
right.
I find that it depends on the person, right? Like a lot of the demographic that I believe I best serve is the demographic that never heard that they could reduce their symptoms, that they could help themselves, that they
Right.
can learn, that they can find something that will work for them. So there's like an overlap there, but
I agree with you. First of all, I think the fact, like, one of the most empowering things is for you to be able to say, this isn't working for me.
yeah.
It's not good, and step away, right? That is incredible. It doesn't matter from what field. And I do, by the way, saying you can like, I hear what you're saying completely. Saying you can heal completely, I would never take that
No
on
one's
my.
ever healed. No one's
Right,
ever
exactly,
seen you.
exactly. So I don't know
Yeah.
what that means. Saying you can reduce your symptoms, yes, but I think, first of all, we don't have control. I don't know why. I don't, like, I don't know why some people are, stuck in bed and can't move, and then other people are. What am I stronger? Are they stronger? What's happening? But what you can do is you can live and you can get better. And there's so much more potential. And that I do think we agree with. And I've heard people, by the way, say that they've needed someone to say, yeah, you can get rid of your pain. I would never take that on because I think it's a false guarantee. The fact that you're able to, and I think we really relate on this point, is like, and that's my goal in the therapy. But that's why we also have protocol. It's not just therapy, groups where therapists will do dynamic work, because that also keeps people stuck in some sort of loop. It's like, no, we taught every session. There's like exercises, there's knowledge, there's information. We teach them about fight, flight, freeze. We help them figure out how to calm themselves. We normalize that when you're triggered, your brain's not functioning. So have compassion for not functioning the way we want. Have compassion, right? We've built this structure and we've built a model in a way that's like giving them back the power, giving them the exercises, and very built in, like, to the therapist. And that's also part of the work with therapists, of letting go of that control. And by the way, there are good therapists and there are bad therapists all over. Like, I've benefited from very natural, non-traditional therapies, completely. Like, and by the way, a lot of that stuff is integrated into the model. So
That's my next question, but I do just want to say before that next question about your, like, going into the more specifics of your model.
Yes.
I think there is an important kind of differentiation here, I think, with psychosomatic and like physical and I don't know if I have the right verbiage here for this, but I think that, for example, like I've had clients that had struggled with chronic pain, but it was headaches, it was migraines, it was shoulder aches, and then they found like journaling and meditations and breath work, and that like it made the pain disappear, as in like it completely eased the pain, but it was a psychosomatic pain. And so I don't know if there's a difference there between what kinds of pain or the root cause of the pain. Do you know what I'm saying?
It's a great question. Yeah, first of all, we have in our groups everybody. One of I think I would call it a corrective experience, a principle that we have in our group is that pain is real. And this is my belief. Pain is real. It doesn't matter where it comes from. Right. My job, I'm not a doc, I'm not a doc,
Yeah.
I'm not a doctor. I'm not here to diagnose. I don't know. And a lot of times when we think we know, people think they know, then it can really get people in trouble, first of all. And I'll give you a couple of examples. What we want to look, and there's many people who deal with that. What we want to look at is the minute pain's in your body. Now, if I have a migraine because I have a problem with something neurologically, with my eyes, let's say, or I have a migraine because it's psychosomatic, it doesn't really matter in terms of it matters very much in a medical way, but it doesn't really matter in terms of the impact I have. I'm still being gaslit. I'm still being told it's emotional. I have a nephew. My nephew, he now is, I think I told you about him, but he is now, I think he's 14. When he was 10, he was acting wild. His head was hurting a bit. He was acting wild and aggressive and behavioral stuff and whatever. Traditional gaslighting is like, he's go to parental guidance, get him some help. He's aggressive, behavioral, right? All the labels. He's getting in trouble a lot. Anyways, my brother, my sister-in-law, who are thank God, they're very privileged and they're able to, my sister-in-law has a medical background. She pushed and she paid privately and she got whatever. Turns out he has a tumor on his head. He has a tumor on his head. He's 10 years old. First of all, he had the surgery. From one day to the next, they took out the tumor. His aggressiveness and his behavioral issues went away. And, year of chemo, thank God he's in remission now. But one of the things that shows is that we've had two people in our groups, one in Israel, one in America, saying that their stomach pain is psychosomatic. And both of them discovered tumors in their stomachs. right? So, whatever help, and irrespective of where it comes from, like let's say my nephew didn't get diagnosed or he did. If it had continued more than a couple of months, his kid is being labeled problematic. He's going to go through a system, even if he has stomach pains because he's having emotional stuff or because he has headaches because he has a tumor. He's going to be not believed. He's going to be treated like he's making things up. He's just being dramatic. So that experience, there's so much unknown about pain.
Just makes me so angry with the system. The system doesn't, it's not, there's so many gaps in the system.
There's so many gaps in the system. There's so much judgment. And it's also, by the way, and even with well-meaning people, and I have to say this, because there is like interpersonal relationships are really difficult because it's really hard to explain something you can't see. And I know I'm very like I have a lot of privilege because I have scoliosis, so my spine is crooked. So I do have medical privilege, meaning if I go and complain about my eyes or my nose, they'll take me more seriously because I have something concrete. And people with fibromyalgia or other diseases or illnesses that they don't have, or even cancer, there's really high statistics of people who've had cancer who have chronic pain. But there's no, after you're in remission, you're fine. You don't get that attention, you don't get that support. And it becomes really confusing because how do you know what's going on with someone? And there's no language, so we don't learn how to communicate it and what to do about it. I really just believe in find what works. If someone is able to heal their headaches, we talk a lot in our group about inner knowledge. There's people, I always do this exercise with people, but like, what helps? Have you ever had headaches before?
Very rarely.
Okay. Anxiety. Can I ask you about that?
Yes.
Okay. What helps you when you have anxiety?
Using my framework, I figure it out what is causing it. So I try to get to the root cause of what's the fear, what's going on, and then figure out in that moment what it is that I need. So it could be journaling, it could be breath work, it could be just realizing that that's what it is that's triggering the anxiety, and then working through that and reconditioning whatever it is. But usually, for me, my anxiety is usually rooted in limiting beliefs or generational trauma or conditioning of some sort. So that's where the anxiety usually comes from.
Okay, well, it's amazing. And you do not that where it comes from, but you do the trauma, like the deep work, and you try and figure out where it is, like what to do.
And then I process it, and like usually journaling is the way forward. But like the minute I know what it is and where it's coming from, then I'm like, okay, that makes sense. And I think for me, fear of the unknown is a big piece, and that just amplifies it. So when we don't know why something's happening, like for me, my post-trauma, I think the extremity of the whole experience was because I didn't understand what was happening inside me. Like I just didn't get it. So once I was learning about like the fawn experience, when you understand why you're fawning, you're not shaming yourself, you're not judging yourself, you're not as angry at yourself, everything just kind of gets better a little bit. Do you know what I'm saying? Like the symptoms reduce automatically just by understanding. And so for me, understanding is the big piece.
That's amazing. That's amazing. I really relate to that also, that out of control feeling and how to get back control. For me, when I'm anxious, depending on more often than not, what really helps me is walking and moving. And I'll tell you why I'm telling you this. Sometimes journaling, also just writing out whatever.
Crying. I'm a crier.
Really?
That's the way I regulate.
Oh, I'm so
very effective.
I'm jealous. That's amazing. Not jealous, I'm envious. That's amazing. So for me, it's walking. Sometimes it's journaling. Why am I saying that? Because there's people who, like we both can deal with anxiety, very different ways of calming our system. Crying would not calm my system. Right? First of all, I just don't, but like it won't calm my system. And going to the root in an anxiety attack, or not just attack, but like experience, going to the root of the problem would give me anxiety a lot of times. There's other people who we always ask, it's amazing. We see like so many different ways of dealing with it. We had someone, and I'll give you a therapist actually. She said, what helps her when she's anxious? She's a very senior therapist, supervisor of she makes memes and sends them to her family. Why am I saying this?
Very cool.
I know. Why am I saying this weird? Because we're talking about we're talking about headaches, migraines. It doesn't really matter. It's about helping people find what actually works. If if I do what you're doing right now, first of all, maybe I'll try it and maybe I'll see, maybe it will help me, but maybe it won't. And if it doesn't, I want to be able to do what I want to be able to connect. So that's personal medicine. Personal medicine is a term coined by Patricia Deegan. She's incredible. She's like she changed the mental health field. She's really incredible. She talks about personal medicine, about how she talks about in the mental health field, we've adapted it into the chronic pain field, but it's the same, about how we all have these ways of working through of healing ourselves that are real, it's really medicine, right? Like for you, the journaling and processing and crying, and for me, walking works the same as what other people do with anxiety medication. And when
Mm,
we realize, right, or like an Advil, sometimes I need to take an Advil, but a lot of times if I shut the, people talk about like with headaches, shut the lights, drink some water, calm it, right? We have these ways, natural ways that we know and things that we can develop that really, really help us heal physically and emotionally. And we want to help people expand their personal medicine toolkit. And that's,
love
it's
that.
what works. And some people, by the way, they need that anxiety medication. You talked about psychiatrists. It's not my
Mm,
favorite field. I'm not a big fan personally of this, but you know what? There's people who it saves their lives.
100%.
People who they should be going and they need to, and there's a few, a few psychiatrists that, I can recommend, and they're incredible because they see the person and they're the first person to say that, I know somebody who said to this person, you're not crazy, you are normal. This is what happens when you have X amount of kids and X amount of job. But sometimes people need that regulation, and good for them for going. And a lot of times there's so much stigma around it that it's the most biggest gift someone could give to themselves to be able to go access that care. And other people
Last time
don't.
I went on meds, it was when I was very, very, very miserable, depressed, drunk. Like I very much believe that it could be a lifeline again, right? It's like if you just need to get functional, if you just need to get through X amount of time, because the world is the way it is. We can't change the way, like sometimes they say, when a flower isn't growing well, it's you don't blame the flower. You like move it, give it better
Yes.
soil, better, sun, water it more, blah, blah, blah. But
Yes.
sometimes this is it. This is the environment that I'm in. I cannot move country. I cannot move, like what do I do if this is the conditions that I have? And
Yeah.
it's not good for me. So then yes, I do believe that it's maybe the only, it's like I do consider it a last resort in a way. Like I would first of all say, and by the way, when it came to the we talked about the root causes of the pain as well. Like first of all, eliminate all the physical, the cancer, the tumors, like yes.
Right.
First protocol is doctor and eliminate all the stuff, and then we would say, okay, let's explore these other things. 100%.
Yeah, completely. First
I
resort,
never take responsibility for anything like that. I'm like, everything is with doctor supervision and like
a hundred, a
nice.
100%. And I don't recommend or not recommend, like, unless it's my own personal life where people are like my loved ones who I feel comfortable enough to say do or don't or whatever. And
Yeah.
by the way, I used to have very strong, like, don't get me wrong, I used to have very strong opinions about what people should do and what I believed in. And then, with time, you realize people are doing the
Yeah.
best, people are doing the best they can. And
Well,
if doing headstands is what helps you, or if your psychiatrist helps you, good for you.
yeah.
Really good for you. Like the world is so hard physically, emotionally. We have so many factors, like you said, we can't control, but also like people a lot of times say, like, and this is something I really want to eat healthy and exercise and eliminate this gluten and dairy. You know how, first of all, I want to say, like, it's so expensive to live healthy and to live well and to get access to all the treatments. Like, there's a real reason why there's a correlation between low socioeconomic status and chronic pain. By the way, and also we're exposed to so many toxins, so many things that we don't, and really have an impact on our anxiety, on our stress, on our mental health.
Yep.
We need
Yep.
to be aware of that.
Yep.
It's been also really hard years in the world over the past 4 years or whatever. But also, even if not, and even if people live their best lives and for some reason they're dealing with serious mental health stuff and they can't, the exercise and the diet and the whatever is not working, and they found help in their psychiatry and that's what gets them through, good for them. Really good for them.
100%. There was two things I want to say. One is that I recently saw, like today, I saw a reel about this guy saying that our clothes with the polyester and this and that is like even toxic to our systems energetically. And in fact, we wear shoes. We need to go as barefoot as much as possible
Yeah.
because of the ions and the grounding, right? And all that stuff. But it's just like we stand no chance based on the amount of toxins and toxins. I had a friend who had endo, was suicidal in her teens because of just not being believed and not knowing what to do and, not seeing kind of an end in sight kind of thing. She ended up she reduced her symptoms significantly to the point where she, said she'd reversed her endo.
Wow.
But it was with meditation and yoga and all these different things that we were talking about. But she was also very much into detoxifying her environment. So like even the pans that we use to cook with have things in it. I don't know. Anyway. But yeah, there was a client that I had, and she had spent her whole life from childhood as well, being kind of constantly bombarded with like, you got to heal, and you do this and you do that, and kind of trying to, even before she was even as a child, I remember, she was saying that she grew up with a coach for a mom and this and that. So before she had matured enough emotionally to even grasp certain concepts, she was exposed to these things and constantly trying to heal. Something wrong with me. I got to heal. And in the program with me, she was like, it was the permission slip I'd needed to just stop trying to heal.
Yes.
Just stop. I literally said to her, like, you are the opposite of my usual clientele, right? Like, stop. Just stop. Don't implement the things. Don't no more tools, no more toolkit for you. Like, you can just sit and binge Netflix. Like, that is all you have to do.
You tell it to me also.
I was just like, literally stop. It's and that's why I really love, I think it's so important that I've had you want to also like really drill that piece in. It is finding what works for you. And even to this day, she's just like, thank you so much. Like it completely changed. And she actually went on meds as well, and 100% like you got to do what's right for you and what works for you. And like most of my content is like, let's get off the meds and let's get symptom free and let's this and that. But it is about what works for you, which is why I was so looking forward to having you on today as well, to like bring this piece to it, because I'm not about bashing therapists or bashing the system or bashing meds or like it. No, there's everyone in every type of situation with their kind of like, it's just finding what works for you. That really is.
Yeah. Wow, that's amazing. And it really resonates. And I think that, what you just said with that woman is, it's amazing because something that I've noticed, like dynamics in groups or also just with people with pain or whatever, like, as we know, there's so much stigma around pain or trauma and how people live their lives. And, we notice in a couple of groups that there's whatever, a specific group, but we've seen it in many other places, is that there's like, the people who are working really hard and don't stop and don't take, which, by the way, that's something that I dealt with a lot, is like, don't let the pain get you down and don't make space for it and just like workaholic and run it. That's better, right? Like that. Why isn't everyone like that? And then you have the people who like, that's more on the live spectrum. And then there's like the pain and like, what's her problem? And why can't she everything's about the pain and she's not willing. And we see this polarization a lot of times between like these people who are doing everything and that's celebrated and the people who are doing nothing. And, when we had this a lot experience in this group, and we had talked about it a lot of how, it's not better to be an overachiever and doing all the treatments. And I'm not even going to tell you what I do and how often I work out and what kind of things. And it's like, one second, but you need someone to sometimes to see you and say you can stop. And that's not better. It looks better because it makes people around you feel, or maybe yourself also feel like, yeah, you're fighting and you're trying, but like, that's all the same resistance to living reality. And maybe that person doesn't give enough time to actually be in the pain of their experience or the difficulty of what they're dealing with. And we want to help them move a little bit on the spectrum to like, maybe you can rest. Maybe it's time to rest. And the people who theoretically aren't doing anything is like, okay, maybe step into life a little bit. And like, how do we create that movement along that spectrum and see what's holding people there?
No, I have someone right now that I'm constantly trying to remind her when she goes into the freeze, like, this is what's happening. She's like, I'm shutting down. I can't function. And the self-judgment, it's just so, like ingrained in her. And I'm saying to her, dude, you're surviving. You're in survival mode. You're freezing. This is what's happening. Don't do anything. Like, don't expect yourself, like, cancel your plans for the next couple of days and just regulate. Focus on regulating. Do whatever you need to do to, like, that's what I'm working on with her right now. Because
she's very lucky to have you, and your clients are very lucky to have you, because it's so rare to find somebody who really has been through it and is able to look at you in the eyes and say, just stop. And this is what's happening. And just stop. Like, that is a really, the voices of judgment that you were just saying now of like, wait, but I have to go and after this, and why am like, it's not her internal voices. Those are they're internalized. But these are voices that come from everybody. Why aren't you doing more? Why aren't you this? Why are you stopping? What do you, why are you being so lazy? Or why you, what's wrong with you? And then to have someone say, no, this is to teach you, say, I know what you're dealing with right now. And this is how your brain is functioning. This is how you're functioning. It's survival. And give it attention for 2 days. Is like, when you just said that, I had like the biggest release. And it's not me and it's not my life. It's just like, it's this release of like, wait, Nahon, that's right. Like, let's, right now, this is what I need to like go into this like hibernation sort of for 2 days and like recover from my response or recover from what I'm dealing with and like make space for that because it's really real. Like a lot of times we look at what happened to you, like, Oprah's book, like what happened to you. But let's talk about what's happening now. Like, what are you going through and that response and making space for healing, and for loving and being kind and compassionate to the way I'm responding to that situation.
Yeah.
I think like that's just what you gave her permission. Like that's what I heard at least. Like what
Yeah.
you gave her permission to do is like, no, your response deserves respect.
Yeah, it's just we don't understand our systems, and so then we judge it, and we're like, what is going on, and we don't know it, and then that makes it all amplified and so much worse. Like,
Yeah.
literally, it's just the way I
Yeah.
see it. But
And that's it. By the way, that's the pain trap. So what we focus on live the pain is like, I don't have control of people's diseases. I don't have, people don't have, we don't, but like you talked about the person who healed her endo from meditation and which is amazing. Someone just told me about, a friend of his who deals with a very serious medical condition, like objectively, like on all the documents and what, a medical test. And she did a really intense process of ayahuasca and it went away, right? Now, which is amazing for her.
I've also heard of people doing ayahuasca with the wrong kind of people that not in the right, like
100%. I'm not
informed.
advocating.
Informed decisions, I think, is the best.
I'm
takeaway from
sorry,
that
let's just be
piece.
clear. I'm not advocating ayahuasca. I will not do it the same way I'm not going to do these things. I'm just saying, like, we don't know, like, no, I'm definitely not. I know many people with illnesses that went to ayahuasca and it didn't.
No, because Dr. Gabor Mate, he's a big advocate of working with ayahuasca, but only in a very controlled, what's the word, like certified. It's not really even a certified ayahuasca shaman. I don't know what they are, right? But he's a big advocate of it.
No, so I'm not against, I'm not for, and I'm not doing, I personally don't, I'm not interested in that, but definitely educated decision, definitely research it, definitely look at the risks. Professionals, like that's what I really believe in, like go to people and also, and we have like, maybe I'll share this with you, maybe we can share it, but how to pick a therapist, we have an article about this, how to pick a therapist, any type of therapy, how to know if it's working, right? One of the things we always look for, my sign of a professional, is somebody who who tells you about the other options and doesn't think they have all the answers. In all the fields. Therapists who say physio is the way, psychiatry is the way, dynamics, you're out. I don't care how good you are. When you recognize it is just a piece of the puzzle, it's just these tools aspects. But what I want to say is we don't have control over those diseases or illnesses within ourselves also. Like we could do the best we can. But what we look at and our focus is on the pain trap, right? How the stress of the pain and the anxiety around it, fear, the fight, flight, freeze response, how that creates more pain, right? If I live with pain, I live with scoliosis, fine. When I'm anxious about every flare up, what happens when you're in hypervigilance? Your cortisol, your neck tenses up, your muscles tighten. Get me out of here, get me out of here. That in and of itself has a physical response. And it's like your brain responds differently. And if that continues, that hypervigilance continues, that delichut continues, that creates more medical stuff. And that's what we can stop.
100%.
That's what we can.
The thing that's coming to mind is when I was in labor.
Yes.
And I had like big contractions and I was going like, like this is pain. I was like 5 centimeters dilated. So I was like kind of in the middle of the labor. And then I remembered the hypno breath work and the midwife came, I had a natural birth. Wow. Midwife said, like, she took my hands and she said, relax your shoulders, relax your hips, which is like, going against the anxiety, like pain, right? It's like, relax it. And the concentration it took me to relax the muscles when I'm in pain. And then breathing, focusing the mindfulness on focusing through breathing through the nose and the mouth. And I needed like absolute silence. No one could touch me. No one could talk because of the level of like effort it took me to concentrate on relaxing. And then I was able to literally just breathe through the contractions and the pain. And they're like, is she even contracting? And they could see like jung. And I was just like in the zone. I was like hypnobirthing, right? But it was the most incredible experience. I could feel the pain. I could feel it, but it's like
you're not resisting
out of your head and into your body. I wasn't resisting it from the fear of it, right?
Yes, that's exactly that.
It made it more like I could sit through it somehow. Like I could sit with
it. That's amazing. What happens? Like we have this pain. I'm showing you my hand, but that doesn't help the audio. we have this pain, and then we're so scared of it, and we're so scared when it's gonna. How does pain work? You don't know when your flare up's going to come. You don't know how you're going to respond. You don't know what's around. So you're constantly hypervigilant because pain is not stable. It moves from place to place. It can come out of nowhere. You can be fine. I can like hike 25 kilometers a day when I'm on vacation, and then I sleep the wrong way, and all of a sudden I'm like completely. So you have the pain and you have the resistance to it, and that creates this resistance and creates more pain, and that's a pain trap, and it's physical and emotional, right? If we're scared of our anxiety, which is totally normal to be scared. All these things are normal. We're not trying to say anything, but like when it is, but when we we want to recognize those places of like, first of all, normalize the pain and not tell people, no, you're not in labor. Or but imagine if I came to you and said, contractions don't hurt. Get get the hell out of here. Contractions hurt, and let's be with what you have. Let's be with that instead of resisting. Oh my God, it's coming, it's coming, it's coming, and then you create this like boom, 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 and like this contrast resistance, and that makes it much worse, and that's the pain trap. And that we're like, no, here we can stop. Let's start to recognize how we physiologically respond to the fear of pain, physical or emotional, right? We all know when we go to a certain family member's house or certain doctor's appointment, we all know how we are before we walk into the hospitals. We know that's coming, so let's learn how to identify, how to prepare, and recognize, okay, we have very little control over our responses in those moments. Well, how can we ground ourselves through it? What do we do after? And then those like 2 days that you told your client, how do we, okay, once again, it's a real thing, and how do we calm down from that and support ourselves through that?
So I'm going to share a reframe that
Okay.
I have shared in the past with my clients and my programs and stuff. So the way I view symptoms, or like to view symptoms, certain symptoms, it's oversimplification, overgeneralization, right? But it's imagine someone coming at you screaming in a foreign language. Like, you would be terrified. You would want this crazy person seemingly to want to just go away. And you would do anything in your power to just get rid of this thing, right? This person coming at you. The reframe here is that person's coming to you because they want you to listen. They want help from you. They need like your help. So instead of trying to get rid of that symptom, to then say, okay, let's try and help. Like, I will learn your language so that I can then communicate with you, and then learn what it is that you need from me so that I can help you, so that you don't have to be screaming at me. Because if you can learn to hear your body whisper, you don't need to hear it scream. And that's something that
if you can learn to listen, if you can learn to hear your body whisper, it doesn't have to. Yeah, no.
I love that like quote. Years ago, and I've taken it with me, and that's the way I kind of see symptoms. So we're all like, what the fuck's happening? Like, it freaks us out. And it's legitimately scary. Like, it's a normal reaction to a symptom when you have no idea what the hell's going on. You have no idea what this thing wants from, like, and
Right.
so that's the way like I like to reframe symptoms, is that they just want you to learn how to like when you understand, then you also identify it when it's coming, or how to maybe preempt it, or when it does come, how to maybe regulate and soothe it, and then you shorten the time frame. So yeah.
And first of all, it's beautiful. It's really beautiful. And I think the trick to that is also realizing in the moment, I know I said this, but like in the moment, when someone's yelling at you, you will not be able to think. Your rational brain shuts off. So don't pretend, and don't be like, calm down, right? Like, that doesn't work. Your brain is not going to function. We need to know in advance, what is a language. You need to stay tight. If you know that every once in a while someone's yelling at you in Mandarin or whatever, Arabic or anything else, your time to learn that language is not in the middle of them yelling at you. It's before and it's after.
Yes.
Right.
And it will take time.
And it will take time, and it will take practice. And it could be, by the way, that learning from one app or a second app or a class is not going to work, and maybe you need a private lesson. And that's really, really important, because that takes part, like that fear and the anxiety can go away only if you learn the language in different ways. It's also knowledge. Like, I think that because there's so little understanding of pain, and that's why I talk about it, is like, people don't know, you don't know what you're dealing with. So then you're like, 1 second, this unknown crazy thing is coming, and like, there's very little. Let's put it in context. When does it happen? People get flare-ups before their periods, after their periods, when they do certain activities. Again, if you're dissociated from your body, you will not even be able to start planning and recognizing that. It took me years to start realizing, wait, in certain circumstances, what's happening, what's good for me, what's bad. And also, a lot of his knowledge. Like, I had something with my knees that happened a bunch of years ago, really, and it was really weird. Also, my knees were inflamed, but I'm at a different level, full of fluid, in so much pain, didn't know what it was. All the rheumatologists are saying it's nothing. Now, objectively, there's like tons of fluid. They're taking the fluid out, but right.
Don't tell me it's nothing.
They're telling me it's nothing. I'm in my early 30s. Now I'm 40. I'm in my early 30s. I started falling. I'm standing. I'm, completely fine. My knees would just collapse and I'd fall like in the middle of work meetings. It was really strange. Everyone's telling me it's nothing. I feel like a crazy person. Anyways, I got to this one, it was really amazing rheumatologist in Jerusalem. She says she's listening to my symptoms and she's talking to me and she says, and by the way, nothing's showing up on the blood test. And she says to me, there's this, it sounds like this type of rheumatoid arthritis that is not throughout your entire bloodstream. It's local. And this and this and this is how it operates. And I was like, oh my God, it's that, it's that, it's exactly. She said, and what you need to do is when you're in the middle of a flare up, you need to get your blood tested around that area when you're in a flare up. And she gave me her cell phone number. I said, how am I going to get to you to get appointments with you every 6 months, a year? She gave me her cell phone number. She said, next time you're in a flare up, you call me and we'll do a test at it. And I have to be honest, first of all, like the next couple flare ups, I wasn't able to get there. I was like, but just that, no, I'm telling you that story, first of all, because most doctors don't look at you and in your face, they're in their computer and they don't know. She was the first person to even say it. But I went home, I read about it, having her cell phone number and also having the knowledge. Also, I knew what I was dealing with. And you know what? I know when they come now. I know how to identify them. I also know that they're going to be over because it's around certain thing, whatever. I obviously diet and things, but it doesn't scare me anymore because it's a real thing and it went away and I can deal with it. And yeah, it happens every once in a while, but I don't feel like I need the test anymore because I know how to prepare around it. I know how to deal with myself when I'm in it and I know it's going to be over. And that's the knowledge and that's the like trust and knowing also, okay, you're like, you can take care of yourself and you can handle it. Anyways, so that was like really powerful knowledge piece and also understanding how these responses work, whether it is the physical illness, whether it is the emotional response, the fight response, the flight response. One of the things that we see, you talk a lot about the fawn, which is so rarely talked about in the trauma field. One of the things that I really obviously the fawn, but like the fight response and what happens to people in fight mode? They're labeled aggressive. And right, what does fight look like? We're not punching people. We go from 0 to 100 when we're talking to the secretaries and just you lose your shit. Excuse me, in the doctor's office, a lot of times at the secretaries, in traffic, all these places. Now you're labeled aggressive. You're labeled the problem patient. You're labeled, right? No, something's happening there. And you're responding to something and you're not aggressive. You're triggered. And when we understand, by the way, and I really relate to what you said before about how you process, and that's through deep work, but like when we understand, why am I being triggered here? A lot of times it's because we feel like we have no control. Where can you get control back? But these things, like when we misunderstand them, or the good patient, a lot of times the good patients, they're not good patients. They're either fawning or they're frozen. And that's where damage happens.
I have to just interject here and share that there was a guy at the PTSD treatment program, and he was just stuck in fight mode. He was constantly screaming, shouting, throwing shit, like constantly. He was this 50-year-old guy. And at first you would, without knowing anything, you'd say, that's a crazy person, right? Like you would judge this guy is like just legit losing his shit constantly. Like there's something wrong with this human. And then when you hear his story and you hear like it, oh man, it's going to make me cry. I remember in the group therapy session when he was explaining what happened to him and that he'd fell between the cracks and he'd, been in a terrorist attack and he'd seen his friend get a bullet through his neck and like all these, sorry, trigger warning after the fact, all these different things happened to him and that he wasn't able to function. He wasn't able to handle it and the system didn't help him enough. And now he's a 50-year-old man living with his 90-year-old father in a little apartment in Jaffa on a mattress, sharing a mattress on the floor with no furniture. And this is his life. And all he wanted was to be a husband and a father.
Wow.
And he was just angry. He was just angry at life, angry at the system, angry at the world, angry at himself, angry at he was just legit. By the way, valid, completely valid and legitimately angry. And he said, I'm 50. I don't feel I can I'll find a wife and have kids now. It is gone. And it was the one thing that my dream was to have children and just be a husband. His anger came from that. I remember when I met him, I was like, I vowed to myself, it was that moment that I said, I will try and do something to help people like prevent these kinds of things from happening. Like, I remember it was that moment
Is
with
that moment,
him.
it's just like you, because wow, and it's something like you look at. I don't know him, but you can imagine. I could imagine is how many times he was told to get over it, and how many times, like, what kind of therapy did he get after he was in a terrorist attack? What kind of therapy did he have? Who supported him? Who gave him the treatment he needed?
That's what, I don't even think he got the benefits that he was supposed
Exactly.
to get. Like,
Exactly.
just
But he's
no
judged.
chance.
But he's judged, and but he, you know, he has all the voices and all the people saying get it together, and not being given the rights you have. Not
And
being
how
given
do people then treat him as this angry, raging human walking around thinking he's this crazy person? Like, just everything he's going to
Right.
get then is reaction to his reaction to a very
Exactly
abnormal
that. And I
situation.
want to speak about that for a second, because when we're in whatever mode, and aggression is easy to, you know, it's the easy one because it's so externalized.
Yeah.
But to all of them, a lot of time, any fight, flight, freeze, fawn, respond. People, your reaction becomes a subject, right? So if I'm triggered and I'm like, or not even I'm angry, and what becomes, well, why are you so aggressive, or why are you so this? 1 second, but you're not listening to what my complaint is. Like, you are not treating me with respect, or you're not doing what you need to, or you're not giving me my rights. But that's not the topic. The topic becomes about, well, you don't know how to handle your emotions. You don't know how to, right? And then we're missing the entire point of the mahut, the essence of the issue. Instead, we're talking about how someone responds to it, and that's what happens. And I can just imagine that's what happens with him. And then it becomes this self-fulfilling prophecy and reinforcement of no one's going to want to treat him. Of course there's discrimination in the systems of, you know, people like, why do people fawn so much? Why is fawn such a response? Because that's a survival mode to get what you need. If I don't people please you know how much I flirt, like you flirt in the people pleasing way with your healthcare professionals, because I know how we know how they treat you when you don't. And if you bruise their ego, the reality is, and by the way, I'm talking about this as if it's a conscious thing, but it's not in the moment. But like, you also, why is it survival? Because you need to get the care you need. And if you tell them to their faces, you know, if you act like that guy in Jaffa did about, you know, that he's not gonna get his prescription. He's gonna be labeled a drug seeker. He's gonna be labeled you know, all these problems, what they do with people who have borderline. Well, they're leaning to like the borderline one, or the complex PTSD patient, and they throw you out instead of saying, 1 second, I'm telling you something's happening here. Physically, emotionally, interpersonally, everything becomes attached to this label of symptom, of response, and then you get thrown somewhere. And you can't survive like that.
Yeah, I feel we could talk for hours. And so
I know
I'm going to kind of stop in here for a second and just say, is there?
I forgot how fun. I didn't forget how fun it is to talk to you, but I appreciate this conversation very much.
Me too. I genuinely, I want to say, I think, or I believe, I know that what you're doing is game changing for the industry, for the system. I believe that what you're doing is really, really important. And I am just so honored and humbled and genuinely like really appreciated that you're here and that you gave me this time and the listeners this time. And I do sum up though, is there like anything that we didn't say that you'd like to say that you wanted to mention, that someone listening with chronic pain, maybe you'd be like, just do this or start here or something?
Thank you so much. I appreciate what you said very much. And I feel the same about you. I feel very honored to speak to you. And I feel like what you're doing by having real, genuine, honest conversations where I lost myself in the conversation. This isn't a lecture. This isn't a workshop. This isn't an agenda. I'm like listening to you and learning and benefiting and gaining as much from you is really, really a gift, because there is so much out there. There's so much bull out there in the fields of health and mental health. And just having someone who will look at you and talk about real hard things with the light that you have, and you really bring a light to what you do with hope and change while seeing people. I think that's really a gift, and that's why it's really an honor to be here. It's an honor to speak to you and connect with you every single time. And I'm grateful for it. I'm grateful for what you're doing, and I'm excited to hear the rest of the podcasts that you're putting out. And if people are listening with chronic pain, aside from all the things I said, it's just like, first of all, I'm sorry you're going through it. It really sucks. It's really hard. Not just chronic pain, physical pain, emotional pain. It's really, really hard. And I wish it was easier, and I wish it could be, and it can get easier, but I wish it was. I wish you weren't dealing with it. And there is hope. I think that's such a weird thing. I can't believe that just came out of my mouth, because that's so not the voice I usually, maybe I'm being influenced by you already. Probably. I don't think I've ever said that in anything that I've done. But no, there is help, and if like it can be lived with. You, I don't know. I think that wasn't. It just I see you, I feel you. You're not alone. You're really not alone, and I think that's really why I developed the groups, is just like so people can realize like you're not alone in your pain, and you're not alone in your ability to heal yourself. And there is so much. I think when what we spoke about, like releasing this magic solution, like pain is really painful. It's really hard. And is what to do about it.
Like the thing that I want to that comes to mind is Carl Rogers, who said that the prerequisite to change is acceptance. And I feel like if we try and fight the pain, it's never gonna, like, it's just gonna perpetuate, kind of thing. And I feel like what you're saying kind of ties into that of like, it hurts, and I see you and it hurts, and I'm gonna validate that.
And that's at the core. Like we have like a few layers of like in our model of like what the foundations are. One is that what you just said is like it really hurts, and we see it. And I'm not going to pretend that it doesn't. I'm not going to try and convince you that it doesn't, or that if you just try ABC, it won't. And the other thing is like, and keep trusting yourself. And like, I don't know what the answer is for you, and I don't know what your pain feels like. You're the only one who knows. And to keep just trusting. And when you're ready to do something, I think also, by the way, maybe you can relate. There's so many things on our list to try. Like, a lot of times we feel guilty about, I didn't do that yet. I should be doing this. I should be doing more of this. And also physically and emotionally, just trust yourself that when you're ready and able to try that next thing, or to do it, whether it's joining a group or whether it's going to your counseling or doing anything for your own health, or physical or mental health, is like when you're able to handle it, you'll do it and you'll get there. And it's okay to not be there yet. And that's just what I wish is like, is trust yourself, and trust your body, and trust your own pace.
I have a whole thing on self-trust and trust.
Wait, let me hear. Give me, what's your last word?
I mean, I have like a video, like I have a video library, and I have a thing about self-trust as well. Like it's a very big piece, and trust in general, like trusting the timing of things, trusting the universe, trusting that you're being supported, trusting that there's maybe a reason. We can go into the whole like thing, and I don't want to, we literally
in our next call for sure, but
our next one. Okay, amazing. You are amazing. Thank you for sharing your wisdom and your time. Big thank you to everybody listening. Hope you found our conversation as inspiring and empowering and exciting and moving as I did, and all the things. If you enjoyed this episode, please subscribe, rate, and review the podcast on your favorite platform. Your support will help me reach more listeners and hopefully make a greater impact, reach someone who really needs to hear it. I'd also love to hear from you. What was your biggest takeaway from today? I'm sure Aura would also like to hear. And you can find Aura and all of her links. Everything is in the description wherever it is on this platform. Stay curious, stay informed, and stay tuned for more episodes coming your way. Aura, thank you again. Lots of love, everybody.
I love it. Stay curious. I think that's the key to everything. Thank you.
Yes.
Bye.